Welcome, everyone, to this convening of thought leaders and researchers on sexual and reproductive health and rights. AUB has been playing a leading role in increasing services and knowledge production and raising awareness around women's sexual and reproductive health in the MENA region. We've also been conducting extensive research, including a program at AUB's medical center called WISH for Women's Integrated Sexual Health, where we are promoting sexual health and rights through education, counseling, clinical care, and rehabilitation. Part of our effort on this issue involves bringing our faculty together with donors and thought leaders from other academic institutions to work in collaboration to cause change when it comes to these issues. The MENA region does not, as you may know, have great indicators when it comes to sexual and reproductive health of women. Hence our conversation today, which is part of a series of conversations happening during the 67th Commission on the Status of Women at the UN going on right now. With that, I will turn it over to Carla, our amazing moderator.
Thank you so much, Amanda, and thank you everyone for being with us today. I'm Carla Akil. I'm a senior research assistant at the Asfari Institute for Civil Society and Citizenship at the American University of Beirut, and I'm very happy to be moderating this discussion today. Before we begin, I would like to give you some context about the conversation that we'll be having. So in the MENA region, cultural sensitivities and taboos related to the topic of sexual and reproductive health and rights are prominent and may prevent people, especially the youth, from accessing and utilizing SRHR information and services. A recent study revealed that the gap in access to SRHR information and knowledge kind of creates a need for the youth to get their information from the internet. And with the internet being the main source, it further marginalizes people with less privilege and no access to the internet, smartphones, and/or the right sources to use. But accessing SRHR information online is both a blessing and a curse, because in most cases, young people actually will seek answers on the internet regardless of the quality of the information that they're getting. And in most cases, they are usually neither accurate nor necessarily right, and results in wrong answers or getting misleading knowledge about SRHR. This leads us to think about the importance of the youth's access to technology and the internet, and also the ways in which we can actually facilitate this access for the youth, and to kind of ensure that they are getting accurate and medical information about SRHR. Today, we'll be exploring all about this dilemma, but before we do that, we'll be learning a bit more about the work of our wonderful panelists today who are working on SRHR. And today we'll begin with our first speaker. I'm very happy to welcome our very first speaker, Susana Pavlou, who is the director of the Mediterranean Institute for Gender Studies in Cyprus. She has over 18 years of experience in research, policy development, and monitoring and evaluation, with particular expertise in gender equality and violence against women. Susana, you have worked extensively on youth and SRHR, and you continue to do so. Can you please give us some highlights of the work that you're doing and the important lessons that you have learned?
Yes, thank you. Thank you very much for the introduction, and I'm honored to be here. I wish I was there in person, very much so. And thank you for the question. So just to give a little bit of context, I think for Cyprus, where MIGS is based and where we predominantly operate. As in many other countries, particularly in the region, tradition, culture, and religion play an important role in preserving the patriarchal structure of Cypriot society, from education to political representation, from violence against women to sexual and reproductive health and rights. Traditional values and rigid gender roles are pervasive. Domestic violence, sexualized violence, sexual and reproductive rights are still taboo subjects, and gender norms and stereotypes dominate all areas of society, and including political and public life, education, and the justice system. We also have a powerful Greek Orthodox Church, which contributes to the perpetuation of gender roles and norms, including in relation to sexual and reproductive rights. For example, it is opposed both sexuality education very vehemently, particularly recently, because there's been a lot of public discussion on this, and in relation to access to abortion, of course, and the laws of Cyprus and the implementation of laws have reflected this. So in this context, young people have very, very little access to sexual and reproductive health information. In one recent study, they called it practically non-existent. Even among peer groups, there's often this sort of non-verbal subliminal message that these topics are best avoided. And of course, as you mentioned, the primary source that they have is the internet. And this is compounded by the fact that civil society in Cyprus is traditionally weak, has only in recent years sort of expanded, albeit under restricted environment, not very conducive to human rights. And so there are organizations such as MIGS, but I should also mention others such as the Cyprus Family Planning Association, Accept Cyprus, that worked on with the LGBTQ community, and other organizations that work systematically on these issues. I think it's also important to mention that given the widespread use of the internet and social media, young women and girls are also impacted by the backlash on women's rights and the values and visions forming part of it's the values and visions of feminism. Both in Europe, but beyond. This backlash not only comes top down, religious, conservative, populist traditionalism, but also in the name of progress, successfully pushed in non-conservative mainstream media and popular culture, rebranding sexual exploitation as empowerment and sexual desirability in the eyes of men as a form of power. So I think we're witnessing a pressure and containment at the micro level in our national context, in our classrooms, in our relationships with our peers, in intimate relationships, our families, our communities, but also top down in the form of hypersexualized models of femininity that have shown to have a negative impact on the mental, emotional, and physical health of girls and women on a global scale. We're also seeing a massive increase in consumption of pornography by young men and boys at an ever younger age, and this our research at MIGS has shown this. And so children are learning about sexuality from unlimited access to online pornography, which bears an alarming impact on the image of and practices of sexuality. So technology, as you said, is and access to the internet is both a gift but also a peril. Online spaces are not conducive to information and learning on sexual and reproductive health. It exposes young women and girls to misinformation, but also to sexist and misogynistic content and online violence. Which such online violence, in the manosphere and this increasing sort of misogynistic rhetoric and discourse that women and young girls are exposed to when they look up issues of sexuality education online. So there's a lot of work to do both at the micro level and at the macro level on this issue.
And looking at our context and taking into consideration the impact of the gendered social norms that you just mentioned and the heavy patriarchal structures that exist, what would empowering and transformative HR strategies would look like, in your opinion?
Yeah, this is obviously a challenge, right? Because we're always faced with all these different challenges and how the online sphere is constantly changing, and so it's a challenge for us as well as women's rights organizations, as human rights organizations, to keep up and ensure that we are providing sort of alternative spaces for young people. For information and spaces also to share in a safe way, in safe spaces with other young people, but particularly among women and girls. So, and I think their socioeconomic empowerment, independence is dependent on having this access to education, information, and technology is obviously crucial in the digital generation. So I think we need to think about sexuality education. I think it needs to be embedded in feminist principles, and this is what we have been doing at MIGS. And there's this. We've been using many practices in order to do this, and some successful initiatives that we have developed, but also in partnership with other organizations in Cyprus and but also in the region, always involve children and young and youth directly. So I think one successful strategy should always be that it's not led by us, but led by the target groups, that they know best what mediums are most conducive to their learning. They know best by discussing with each other in these safe spaces that I mentioned. We have used methods such as vlogs and blogs by relatable adults and peers, by sort of influencers, if you like, that they feel that they can trust. We've developed mobile apps and websites. And this has become sort of a safe space, again, using technology, where they have access to reliable information. And these sort of practices have shown a lot of promise. But it has always been a principle of ours that needs to be led by youth themselves. And so we've developed these online spaces and these digital tools with them for them. So we provide the technical expertise, but they provide sort of the learning and the content. And so we've used sort of this learner-centered approach, which I think using experiential and participatory activities in their development. And in this way, they're encouraged to learn from each other, to explore their own attitudes and the impact, everything that I mentioned previously, what the impact is on their lives and their institutional environment. And just one last thing, and I'll stop talking. But I think in our recent experience, particularly in the context of Cyprus, but I'm sure this is the case elsewhere as well, while most of our activities have been sort of mixed sex groups, working with both men and both boys and girls. I think that it's become increasingly evident that despite sort of this push, and I would say it's donor-led to a great extent, to involve men and boys in the work that we do in this area increasingly, which I think is, I should state that from the start, I think is very important. But I think there is a lot of need, and this has been expressed very clearly by young women and girls, that there is a need for safe single-sex spaces to express and share their lived experience, and spaces where they can defy the conventions that stifle and repress their voices. And I think that is really important, particularly around issues such as sexuality and sexual agency. So yeah, I'll stop there.
Thank you so much, Susana, for these insightful information, and we'll definitely get back to you. But I think it's time for us to kind of introduce our next speaker and move to Dr. Faysal el Kak. Thank you so much for joining us. Dr. Faysal is the Vice President of FIGO, the Director of the Women Integrated Sexual Health WISH program, and the Clinical Associate of OBGYN and Female Sexual Dysfunction at the American University of Beirut Medical Center. Thank you so much for being with us.
Thank you.
Tell us a bit about why and how did the WISH program come about, and how do you see such SRHR initiatives picking up speed in other Arab countries?
Thank you very much, and hello to everyone. Again, I wish I can be in person with you. I'm glad you're giving us this opportunity to be part of this activity and this webinar. I will have to again share the same context and background like my colleague panelist Susana mentioned regarding this region. And as practitioners, as providers of care, and as researchers, we've been working on sexual health, basically in terms of awareness, in terms of attitudes, in terms of pushing services, in terms of raising the level of advocacy, and even impacting policy through our work with the sexuality education. With all this, the thought was we should have something which should be positioned very well in Lebanon and in the region, a center that is able, or a program which is able to really have three tiers. It has the research component, it has the service component, it has the advocacy component. And hence the idea came of the WISH program, Women Integrated Sexual Health Program, to emphasize one important thing at the very beginning in the name, that sexual health is a central and integral part of women's health and, of course, of men's health and everybody's health, but want to focus on women in specific. So that's something important. The second message was that we are positioning something which is solely dedicated to the comprehensive understanding of sex and sexuality within an academic and the prestigious center like AUB and the AUB Medical Center that will talk not only to the local national context, but also to the region, which is the first program in the whole region that's placed within an academic center and normalizing the talk on sexuality and sexual health. At the same time, we are able to produce and contribute to research and to dialogues happening in Lebanon and in the region. And at the same time, we're doing something which is very peculiar, and that's because I think of my professional bias as a provider. We've been conducting workshops with healthcare providers, pushing them to integrate sexual health care as part of their clinical care and also preventive care. And that's very important. Every month in Iraq, in Jordan, in Dubai, in Saudi Arabia, in Tunisia, we almost are covering most of the regions, reaching to every provider through the WISH program. So this program, it sends a message on its own by being there in this place. Of course, we are aware that you have many initiatives going on. There are many people who are interested in online saying this and saying that, but WISH is positioning itself as an academic program, yet it's a reach out program, and at the same time, it's a program that addresses providers and the clinical care. And remember, when you talk about sexuality and sexual health, looking at women, you're not talking about a specific dysfunction. You're looking about at something across her lifespan, in her health condition and illness condition. When she's pregnant, there is sexuality and sexual health. When she is a cancer survivor, there is sexuality and sexual health. Same thing in the adolescence, in the menopause, in all aspects of her life. And at the same time, we thought, again, based on research, based on needs, and as my friend Susana said, we created a platform which is completely led by young people. I just sit there, I just clear the contents. We have a very rich platform on Instagram and on other social media, all run by people between the ages of 18 and 22, 23, 24, for free. They're all volunteers. We're not paying any penny for anybody, not even for the platform. We have in no time about 4,000 followers. I had a digital analysis I wanted to share, but apparently it's okay. But I can tell you, we have people from Lebanon, Riyadh, in Saudi Arabia, Doha, Dubai, and we have at least 8,000 to 10,000 interactions over our posts that includes new topics, different topics. For example, the number one hit was the one on consent. Consent. That was something so attractive to people. The other thing has to do with condom use. The other thing has to do with sexual identity, with gender roles. So we're trying to normalize this talk And we're trying to tell people that sexuality and sexual health and sexual rights is way beyond the sexual relations and intercourse and so on and so forth. It's more about your central aspect of being human. It's about an essential core dimension, and that's important to send it through in this. And I think there are many challenges, of course, but we are today better than yesterday, this year better than last year. Of course, we launched the program, and then suddenly all the crisis of Lebanon hit us, and then came COVID. But we're doing fine. We're reaching out, and here we are. Thank you. You're inviting us to speak about WISH, and we are very proud of this. And of course, we look forward to your comments, feedback, and of course, collaboration in the future.
Thank you so much, Dr. Faysal. I have a follow-up question based on what you just said. You mentioned that there has been some challenges. So I was curious to know, when you launched this program, was there any backlash from the public that kind of tried to challenge this? That's number one. And another challenge, just to before you answer, do you feel like being on the internet in general, it might create some sort of problems for people who are engaging with the content, considering that it's taboo? Have you thought about the safety of the
That's why we have more engagement than likes. See,
Yeah.
They have more views. When you do the analysis, people
Yeah.
don't put likes, but you know they have been there, they have seen it.
Okay.
So to go back to your first question, in fact, we received so much media attention because we had this campaign, which was prepared by the media department at AUB. We received a lot of attention, and wow, at last there is something within AUB and within a university in Lebanon and the Arab region are talking about sexual health, and that's important. So that was really a great attention we received. At the same time, some people criticize us because we're saying don't silence sexual health and so on. But that's technical. But we did not receive any like negative comment or hate mails or threat mails or anything. On the contrary, I think, and I can say this based on experience and based on research, the fear is in us, not in the people. People want you to talk about sexual health. People want to talk about sexuality, like the patients we see in the clinic. We create our own fear. We create our own barriers and say, no, we cannot. This is the Middle East. This is the Arab region. This is Latin America. This is this is that. No. I know you are navigating in a very turbulent landscape. But at the same time, people are, if you come in with science, if you come in with evidence, if you come in like there is something for you in your well-being and in your promotion of health, definitely people will respond. I'm telling you, we're talking about something really very daring. One of my colleagues, gynecologists, called me and said, what is this? This is too much. You're talking about promiscuous and lesbian and anal and this. And I said, well, she told me, this might be the American propaganda infiltrating the WISH program. I said, give me a second. There is nothing American about it. So we're trying to be as open as possible. Yeah, this is, I think we have to pay attention, Lena and myself, about this American agenda hiding somewhere. So people start saying things. That's not true, but it reflects that we're touching everybody and we're reaching out to everybody. And we are really exploring all the scope on this. As for the other point you mentioned about any obstacles, no, or something. Well, definitely, for example, financial is an obstacle. I have been fighting to bring the HPV vaccine, for example, over the past 3 months to get it to, it's the only place in Lebanon giving HPV. HPV is very expensive. One dose is $160 in Lebanon today, and that's a lot of money. Screening for sexual infections is a lot of money. A lot of people want to do it. It's expensive also. So there are the financial issue. The access issue is okay, it's getting much better with ensuring privacy, confidentiality and everything. But definitely you need time and you need more resources to be able to to really push this forward. And a lot of people, a lot of donors, a lot of sister agencies are willing to collaborate to help us push this. But at least at this stage, I can say we positioned ourselves as a WISH program in a place where we are credible enough to go and talk about sexual health and sexuality as RHR and really push this forward in Lebanon and in the region.
Thank you so much, Dr. Faysal. We'll get back to you. Before I get to Zeina, I would like to ask the attendees, if you have any questions, feel free to put it in the Q&A. We will get back to it later after, at the end of the session, but feel free to put all of your questions in there. Dr. Faysal spoke about funding, and today we have Zeina with us, who is the Executive Director of the Doria Feminist Fund. You are also an AUB alumni and a member of Australia, the International Network of Feminist Funds. So as the Executive Director of the first feminist fund in the Arab region, the Doria Feminist Fund, can you tell us a bit more about the context in which it was established, the needs, what came about, like what led to its creation?
Hi everyone. So before I start talking about Doria, I would like to give a bit of overview of the context in the MENA region on SRHR. Actually, we still have discriminatory laws. Abortion is forbidden in most countries unless it poses a risk on the woman's health, except in Tunisia, where abortion is legal. We have young people cannot access SRHR services due to stigmatization. So if you're an unmarried woman in any of the Arab countries, you will be stigmatized if you seek a sexual health service. If you're from the LGBTQ plus community, you may face hate. You may be denied access to a service. So all of these factors prohibit the safe access of young persons in the MENA region to SRHR services. So building on this, we're talking on SRHR, but the same applies to GBV, to all other aspects where women in older diversity, women and queer groups face discriminatory roles, social norms that are very much patriarchal. So feminist groups and activists in the MENA region are at the forefront of the fight for social justice for women and queer groups, but the feminist groups and activists in the region are under-resourced, they're always sidelined. So they're facing a shrinking civic space, they're facing a rise of authoritarian regime, they're risking their own safety and security, and they cannot access donors in the north due to their informality. So most of them, they cannot register due to the laws in their countries. They cannot open official bank accounts. And so here where Doria comes to respond to all the needs of those feminist groups. Doria came to life, to existence in 2021 by activists from the region. So we're the first feminist fund that's founded by the region and that responds to the needs of the feminist groups in the region. Doria seeks to provide financial, technical, and political resources to those groups. So we offer grants, 3 types of grants. We offer core support because, as you know, most of the groups and the women organizations, they need core support, flexible funding to enable them to pursue their activism, their activities. And we provide project-based grants and knowledge production. And we really emphasize at Doria the knowledge production component because we're a region that a lot have been told about us, but not by us. Mm-hmm. So there's a real need to narrate our own stories, to amplify the voices of the women and the groups that are actually from the region. They're facing those struggles. So that's why we offer also grants for activists or scholars who wish to enrich the knowledge on all thematic areas, gender thematic areas, including SRHR. And what I would like to note also, the sheer need that we have been sensing. So from our first cycle, our first call of proposals, we have received more than 150 eligible applications. And unfortunately, we're only able to support 7% of the eligible applications that we receive. So this shows that there's an immense need and there's under-resourcing, and that's why we along with our sister feminist funds and trying to influence the feminist funding ecosystem to be able to channel more resources to those at the forefront of the fight. So they're risking their own lives, but they have no resources whatsoever.
And I'm just curious to ask, since you also belong to an international feminist fund community and network, is SRHR part of the conversation that you're having? Is it a priority, or is it something that is being discussed on the table in terms of resourcing initiatives? That's one. And also, do you receive a lot of applications related to SRHR or not necessarily? And if you do, in which areas, which countries in the region do you receive most applications for SRHR?
So SRHR is definitely on the table. Bodily integrity and being able to take your own informed choices about your sexuality is always present in the conversations. We at Doria, we definitely prioritize those working at the intersectional, with an intersectional lens, those facing multiple forms of discrimination. And we've been funding several groups who work on, let's say, period poverty, on queers, queer groups, sexuality, making available the medication as a livelihood, because as we're well aware of, we still have in the MENA region the norms that are, that prohibit the actual and effective being able to be open about your sexuality and embracing the sexual diversity. So we at Doria, we try to prioritize this type of applications. And I would like to note that one of Doria awardees is developing an application, online mobile app that could be downloaded and that includes information on safe abortion, on sexual and reproductive health and rights, to make it accessible for all women in the region to be able to download it on your mobile, to access the information without the fear of being stigmatized. And interestingly, they also have ask us, so you can also like add a question to the gynecologist therapists that they provide. So this is because I want to link like what we do to also youth access to digital services on SRHR. And I think we really need, and building on what Susana also has mentioned, these mobile apps that provide like sort of a safe place for young persons to access information on SRHR while ensuring anonymity and confidentiality and not being kind of worried that they're going to be either rejected or denied the service. So we need a lot more of these services alongside knowledge, because we have research, but we have more of quantitative research on SRHR, and we really need more qualitative research to understand what's going on in the different countries. A recent research about SRHR in MENA has shown, for instance, that in Iraq, because of the language barrier, many young persons cannot access credible information on SRHR from the internet because they're not fluent in English, and most of the credible information is available in English. In Egypt, we have witnessed in the last couple of years organic mobilization on the social media, raising awareness on sexual harassment and on SRHR. But given the censorship and the rigid laws, so most of these initiatives have been withheld. So there is mobilization from young groups to increase awareness. They're asserting their rights and being able to access the sexual health and reproductive health services. But then again, the laws are stand and the social norms are posing a serious hurdle in front of them. And as Doria Feminist Fund, we're trying to support such initiatives that really work with grassroots groups working on raising awareness on SRHR in the various stages.
Thank you so much, Zeina. Actually, I have a question for all three panelists about, so you all mentioned initiatives or digital kind of means to provide these kind of accurate information about SRHR, but as I mentioned in the beginning, there are marginalized groups who have no access to the internet and no access to smartphones to begin with. So I wanted to ask you what interventions or initiatives that we can do to actually access those people who do not have this kind of access to the internet and technology. Have you thought about that? Have you tried to find ways to target and reach those people? And if not, how can we ensure that we get to that eventually? So whoever would like to start, go ahead. I know it's a tough question.
I can start if you like. I mean, we definitely you're right, but I think there is too much generalization that we are making sometimes. I think we are making really good progress in sexual health and in SRHR. I think you have to give credit to a lot of people working in the region who are really pushing SRHR. But at the same time, and as you said, Carla, at the very beginning, pushing this and being online and in the digital arena, it can be really a double-edged sword, because the information that are there, it's not really monitored or cleared by anybody. And it is up to the person and the perspective of the person to be really loading this information. I believe a lot of people, I have been working a lot with the refugees and the refugee community in the east of Lebanon. And at least 75 to 80% of them, they have access to the internet and to access to the digital space. But I agree there is still some people that you need to reach. And one of this, at least for us as WISH, we are working with a grassroots NGO and another civil society group that works in the north of Lebanon in Tripoli. And we're trying to, in person, reach out to some of the young people in this really marginalized and underprivileged area in Lebanon. I think many experiences that WHO documented from similar areas in the world have done a lot on grassroots experiences and some form of digital reach out that they practiced in Afghanistan at one point. And I think it's a good idea to come back to this and review it. But as for us, at least, we are working on whenever possible with the grassroots NGOs to reach to this. But if you allow me, I don't see if you have time. I'm sorry I'm taking, but this is because you have it's your thing. You have put a very interesting question. That's why. So the thing is, I think there is a kind of discourse which is global that we don't have to follow all the time. You see, if I am in a region where I am fighting to normalize the talk on the sexual health and sexuality, at least give me the time. Give me time to do that. See, yeah. Give me time to do that before I start thinking of, there is a lot of people to think about. I always tell them, I think I'm very much for, and we work for all types of sexual orientation expression, but also there is so much problem with the heterosexual. There is so much problem with the sexuality education. There is so much problem with the policy. And so when people are working, I think they need to have some time to start positioning sexual health in this region, which is way different from what's happening in Scandinavian countries or Western Europe or North America or other parts of the world. It's very difficult to start this debate and this discussion. And then I think you start escalating. What also we miss, and I think Zeina referred to this, so probably we'll get some money from Zeina on accomplishing this point. We need to have more discussions, more collective discussion on and mapping on what everybody is doing so we can complement each other. This kind of discussion that Lena always wants to have, it's not happening properly because really we don't have to repeat the same thing everybody. If you look at the social media, everybody is talking about the same thing. And sometimes they copy from each other. I mean, it's fine. I understand the plethora of things happening and everybody is excited about talking about it and everything. It's fine. But at the end of the day, you have to come to a place where you have to start complementing each other. And then you can reach out to more difficult sectors like marginalized groups, non-digitalized groups, sexual illiterate groups, so on and so forth. Thank you.
Thank you so much, Dr. Faysal. I saw Susana nodding. Would you like to share your thoughts on what has been discussed so far?
Well, I completely agree. So I won't repeat what I've already what's already been said. And I think we want in as well in this mapping of what is happening in the region. And we have, listening to Dr. Faysal, I mean, we have so much to learn from initiatives that are taking place in other countries in the region. But I just to go back to your question on working with marginalized groups. So I didn't mention this in my first interventions, but we do. There is a lot of effort from organizations such as MIGS, the Cyprus Family Planning Association, but also UNHCR Cyprus, to work with to work with those who are most vulnerable, which in Cyprus are, on the one hand, domestic workers, which is a very similar situation to that that is in Lebanon, for example. Their status, their legal status, and all the challenges that they're experiencing. And so what we have done is we mostly worked with them face-to-face, not through digital means, although very interesting and innovative initiatives that they are within their community, because they're increasingly becoming more organized, although they're not allowed to be organized by law, but they're increasingly informally organizing amongst themselves. Of course, they're predominantly, if not 99% women, and are very much becoming more involved in activism within the community, particularly on sexual and reproductive health and rights. And we had worked with these communities years back, but now they're just sort of taking a life of their own, and they're doing the work within their own community, which is, I think, really, really important. And of course, with all the support for, that they can get from organizations that are established sort of in Cyprus, formally established in Cyprus, for example. Other groups which are particularly in need are, of course, asylum seekers and refugees, which are living under horrific conditions in Cyprus, and who the women that are the asylum seeking and refugee women are at least 50%, according to the research that we did with incoming asylum seekers in 2019, 1 in 2 women had experienced some form of sexual or gender-based violence. The women that we spoke to, and this was a piece of research that we had done with UNHCR, had experienced severe sexual and reproductive health issues as a consequence of sexual violence, including pregnancy, miscarriage, and a number of other issues, along with other health issues as well, like mental health issues and so on. So I mean, and I agree that there's only so much that civil society can do, and that how important advocacy is, and civil society organizations that work with these communities, but also UNHCR is really at the forefront in Cyprus of these issues, are really pushing and advocating for access to information by the state authorities, access to information, and access to culturally appropriate, gender-sensitive, sexual and reproductive health care for women arriving in Cyprus. So there is that element as well, because our access to these communities is limited in the refugee camps and in the reception centers. So it really is a point of advocacy for us that state authorities need to take responsibility.
Thank you so much, Susana. I don't know, Faysal, if you want to add anything before we move into the discussion.
I just want
I
to add
think, yes.
You want to go ahead, Dr. Faisal?
Zeina, you want to go? Go. As you
I
like.
just want to mention some numbers because, to complement what has been said. So in 2020, research shows that around 73% of youth in MENA had access to internet. But there's also like differential access even in terms of accessing internet between men and women. So 65% of women had access, whereas 75% of men had women. So it's just like to put some numbers on the table.
Yeah. That will change, hopefully. That will change.
Go ahead, Dr. Faisal.
I just want to conclude on a note that if you review the recent data from the Lancet Commission on SRHR and Guttmacher Institute and the FBI report, they talk about 4 to 5 neglected areas in SRHR, and I think that it's our responsibility to be part of this issue to address. And they talk about post-abortion care, they talk about family planning and contraception, and they talk about gender-based violence, and they talk about adolescence in terms of sexual and reproductive health and teenage marriages and stuff. So people are already identifying these 4 to 5 neglected areas. You know what's common among these neglected areas are 3 things. That's, I think, also where our energy should go. These 3 things are the access to the service, which we always oversee sometimes or don't fund properly. The other one is about the quality of care in the sense of privacy, confidentiality, non-discrimination, and good service. And the third one, and this Lena would like very much if she's still here, is the intersectionality. Intersectionality, because we think we can cater the same thing to the same group of people, or we can design that service to this amount, to this category of people. It's not. So we have also to understand more the analytics of intersectionality while we are addressing these 4 or 5 neglected areas in our SRHR. And I thank you very much, and good to see old friends and new friends, and thank you all for being here.
Thank you so much, Dr. Faisal. Before we close this event, I would like to take some questions from the audience. I know here we have a question, so maybe if you also have any reflections, go ahead and say them and maybe ask your question.
Yeah. First, thank you so much, Susana, Dr. Faisal, and Zeina for the sites you provided.
To higher your voice. Yeah,
I hope you are hearing me now.
Yes.
Yeah, thank you so much. And also say hello to Hashim from my side, Dr. Faisal.
Okay, I will.
Yeah. In my opinion, the topic on sexuality and reproductive health has 3 dimensions. First is the knowledge, access to service, and the power. And I think most of the discussion today was on the knowledge and access to services. And you are making a lot of efforts, and I appreciate that. But in my opinion, and here I want your opinion about that, in case we are only focusing on knowledge and access to service without empowering the women to take the decision, because if you have the knowledge and you have access to service, but you don't have the power, how can you negotiate with your partner? So in case there is no empowering for women, especially on the economic level, so she can negotiate with her partner, I think it will be limited. So I have 2 questions. To which extent do you think focusing on knowledge and access to service is enough? And are you making a kind of efforts to work on the 3rd dimension, empowering women, like collaboration with ministries or other organizations working on this? Thank you.
Okay, thank you very much. This is a very interesting question. Well, you cannot imagine how much you need to empower the provider in the first place. We just published a paper 4 weeks ago in the International Journal of Gynecology Obstetrics, and the knowledge of the graduating medical students, which means the future doctors, in sexual health and sexuality is really surprising in a negative way. So these are the people who are supposed to provide the care. As for creating the demand, well, research said women unlikely to come to you and ask you about a sexual problem that they have. But definitely they will love and appreciate and thank you for raising the issue in the clinic. And that skill we are really providing to the providers. But at the same time, I think the work on the social media in WISH and other sister agencies are addressing and attracting a lot of public attention. And that's important, not only to raise the awareness, but also to sensitize women about their sexuality. That sexuality is not outside of me, it's part of me. It doesn't mean if she reads a post, she's gonna go to the clinic the second day. No. But I mean, sensitization by itself and getting her to be more in touch with their sexuality and sexual health and the sexual body is important enough to start her own negotiation with herself about that. This is a long process because this is about school education, this is about the community, this is about policy. But I think, as I said, we're getting there. It's not easy, but it's all in our plans, I'm sure in the plans of other agencies and groups. Thank you.
Thank you so much, Dr. Faysal. Zeina, you have something?
Yeah, I just want to bring it back to like the differential access that we all talk about. So not all women have the same ability to access the service. There's differential access based on the different factors, the socioeconomic status, the education. So all of these affect whether you'll be able to access. And when we talk about empowerment, I think we always highlight the importance of holistic empowerment. So not just making the service available, but working also on awareness raising with the community, with the partner, for us to enable the woman to access the appropriate service. So it's not just a one-dimensional thing. So as Dr. Faysal was saying, we have to work on awareness raising, but at the same time, in parallel to this, we have to work on the community as a whole and amending the social norms that prohibit women from accessing the services and working with the empowerment of the women themselves. Economic empowerment should give her more ability to influence the decisions about her body, about power. So the power dynamics that that affect whether you can access the service or not. This is something that's ongoing. It has to be an ongoing effort for us.
Thank you so much. Does anyone have any other questions before we close?
Could I add something just to the question that was asked, if possible? Great. I'll be very quick. I know that we're pushing time. I know it. Yeah, I just to add to previous speakers, which I agree with, but to that question, we're talking about knowledge, access, and power. In my mind, with knowledge and access, you're halfway, right, to power. Knowledge and access is power. But I take the point, and I think it goes back to, I mean, as I think there are single issue organizations that can only, and I believe that it is important to specialize in. For example, if you specialize in service provision, then you specialize in service provision, right? And that's why I think that it's so important. Or if you specialize in the provision of information and training and sex education, then that's what you specialize on. And I think this is why it's important, as Dr. Faysal was saying, about doing this mapping, right? That many organizations and initiatives provide different things, and it is within that holistic approach. As MIGS, we are not a service provision organization, so part of the knowledge, access, and power is missing, right? We don't provide access. We don't provide services, but we provide knowledge, right? And we do empowerment because we work on women's economic empowerment, women in leadership and political participation, and so on and so on. So I think it is. I think this holistic approach, as was said, I completely agree. We need to take a holistic approach, and that in order to complete the puzzle. But it's not. Not every organization will provide all of the pieces of that puzzle, but only one piece, and then we join forces and complete and complement each other.
Thank you so much, Susana, and thank you to all the panelists for such an insightful and interesting discussion that needs to be talked about, especially within the multidimensional crisis that we have in the region. And it's always important to prioritize issues like SRHR. Thank you so much all for being here. I would like to give it back to my colleague, Amanda, who will be officially closing this event.
Yes, thank you all again so much for being here, and to our wonderful speakers. And join us tomorrow at noon for a discussion on gender and the environment, gender and sustainability at noon, but also go to our website for more information on that. And thank you again so much, everyone.
Thank you.